As the year 2024 comes to an end, it is pertinent to take a look back into the major health issues within the year in review, from infectious disease outbreaks, disease epidemiology, transmission, surveillance, management and treatment strategies, vaccines rollout and vaccination campaigns, to the effects of climate change with regards to heat waves and its resultant health implications across national and subnational levels in different parts of the country, and efforts put in place by the Health Ministry, departments and agencies. We'll take excerpts of discussions with various health experts who spoke in their capacity to chart a way forward. I am Aisha Salihu, and this is Healthy Living on Trust TV. The year 2024 kicked off with the National Primary Healthcare Development Agency pushing for the rollout of the human papillomavirus vaccines, a vaccine that is a major driver in preventing cervical cancer in women and girls. Take a look.
So what we did in Nigeria was a multi-age cohort strategy targeting girls. There are many ways that countries have rolled out the HPV vaccine. Sometimes it's girls and boys, sometimes it's just one age, sometimes it's multi-age. We did the multi-age cohort in Nigeria, and we also wanted to do it in phases. Part of that is because it's a different new intervention in the extent that not just the vaccine introduction, but the population that we're targeting. We don't have as much experience introducing new products in this population, so we wanted to move in a paced way so that we can learn. So that number that you saw us put out as the target for the phase 1 was informed by two things. One is an estimation of the number of girls in target population in the phase 1 state that we should be reaching, but also secondly is the number of vaccine doses that were available. I did tell you that it's a very precious vaccine. It's not a cheap vaccine at all, even though we are providing it for free in every public health facility to the girls that are in the eligible age cohort. What you should know is that somebody is paying heavily for it, but also people that are outside of that age group. Grown women can take it if they want, but they have to pay for it, and they will know that it's not cheap if you are buying it on the market. So we're very particular about being conservative and not wasting the vaccine. So getting just the amount that we need and using it carefully and minimizing wastage and it outliving its shelf life. So that is what I believe accounts for that. Now that said, when we move to the second phase states, which are 21 states, I believe, you are going to see an expansion of the numbers. We're already on track to receive the vaccines that we need, for the phase 2 state and all of the logistical support as well. The mandate of the National Primary Healthcare Development Agency is to provide basic healthcare to all Nigerians. The routine immunization component of the work we do is to make routine immunization available free for the target populations, where the government has determined you maximize impact by saving lives and preventing diseases. Most of those are childhood illnesses that vaccines prevent. Some of them target adolescents in the case of HPV. Some of it even targets adults in the case of some tetanus, toxoid, or other vaccines that pregnant women and other people take. So in the case of HPV vaccination itself, our target is adolescent girls aged 9 to 14. And the rationale for that is that the vaccine is found to be most effective in people who have not been exposed to sexual activity. Once people become exposed to sexual activity, because of the prevalence in the population of human papilloma virus, the effectiveness is found to wane because many people already have contracted the virus. Now, most people will naturally just clear out the virus and not fall sick on account of it or have cancer or die. But you never know who are those people. Cervical cancer kills about 8,000 women annually in Nigeria. That's not trivial. We don't want any one of that to be you or me or my sister or my daughter. So because we don't know who these people will be or we care about all of Nigerians, that's why you encourage everybody to get it. You said something about the pricing, in the private sector for people who are then not covered by this offering that we have. And that's a real issue. It's a big issue that is top of mind for my minister, and he talks about this and is taking concrete steps to address them, not just for HPV vaccine or vaccines, but for all medicines. Costs have jumped dramatically recently for a multiplicity of factors: the valuation of our currency, the general economic environment, but also the exit of certain big companies who hitherto either manufactured or imported at scale. So what the minister is really taking this seriously, and one of the things he's doing is really, a series of market shaping interventions, really looking at local manufacturers to say, how can you support them? How can you enable them to up the scope, but also the scale of what they are.
It is also important to note that the long-awaited malaria vaccines have arrived in Nigeria and were rolled out in parts of the country. Bayelsa and Kebbi, the two worst affected states at the moment. The vaccines being introduced is called R21 Matrix M. The second to be approved by the WHO is being given to children between 5 and 15 months old. Now, Lassa fever disease outbreak is one in which Nigeria still battles. The Nigeria Center for Disease Control and Prevention says about 1,154 confirmed Lassa fever cases and 190 fatalities were recorded in 2024. An advisory was doled out on how Nigerians in the affected states can take precautions, reduce transmission, and manage the outbreak. Take a look.
Cerebrospinal meningitis is a bacterial infection that affects the spinal cord and the brain. So we normally have sporadic cases across the country, and usually during the dry season, it becomes more prevalent. So currently we have about 103 suspected cases, national cases, and Jigawa State has about 58 cases. So there's an outbreak in Jigawa currently. But as you know, NCDC is the Public Health Institute in Nigeria. It has adequate public health systems to detect and respond to cases of meningitis.
You have talked about the disease as being attached to the dry season, and what would you say are the cultural practices that aggravate this? I mean, why so, and somehow making it more prevalent, leading to a possible outbreak? Let's also explore the risk factors and symptoms of meningitis.
Cerebrospinal meningitis is a bacterial infection. It's a respiratory infection. And so there are environmental factors and there are human behavioral factors. An example of the environmental factors are for instance, the Hamilton season where we have more cases. It's because of the dry wind, the heat that irritates the throat lining. And that's the way the bacteria goes into the body, into the bloodstream through the blood-brain barrier. And then the human factors that I can say the top three ones that I can mention right now is overcrowding, being in crowded areas, communal livings. So it makes the infection spread easily because of the close proximity. And then, of course, poor ventilation within those crowded areas. And then you have poor respiratory and hand hygiene. People don't wash their hands as often. They don't sanitize as often. And then just like COVID-19, if you're sneezing or you're coughing, coughing to your elbow. And the third major factor is immunization coverage. With low rates of vaccination coverage, it increases the vulnerability to get meningitis.
Thank you so much, Farida. You did talk about vaccination. So that means this disease is preventable, right? Now, let's also explore vaccine coverage for the disease.
Okay, first of all, public health measures are always the priority. That's promoting hygiene, education, awareness, and of course, community engagement to let people know the risks involved in contracting meningitis. And then you mentioned vaccination. Yes, herd immunity is important. And there's a very interesting story with vaccination. Initially, meningitis, the serotype A, used to be the one that causes epidemics in Nigeria. But because of vaccination, the routine vaccination that was introduced, we do not detect meningitis A anymore in the population. So now there's a new strain that's gaining ground. So the most recent outbreaks that we've had in this country are all meningitis C. So vaccination does work. If it's done regularly, you improve your children. You don't miss your routine vaccinations. It actually is the best form of prevention that we have.
You have stated that this disease is more prevalent in children, but adults also come down with meningitis. Could you put us in the right direction and more elaborately on safer practices for people and also healthcare workers?
Like I mentioned earlier, public health measures, vaccinations, improve living conditions, have well-ventilated rooms, limit the number of people that live or sleep over in a particular room, personal hygiene, respiratory hygiene. When just like COVID-19, because it's all a respiratory infection. When you're coughing and you're sneezing, cough into your elbow, wash your hands frequently. And then, of course, for healthcare workers, they need to have a high index of suspicion for CSM. During this season, they should be able to identify this as a possible CSM, suspected CSM case, and then take a lumbar puncture, which is how we diagnose meningitis and how we find out what organism is causing this epidemic, and before treatments, before giving them antibiotics.
In the year in review, a particular neglected vector-borne tropical disease, dengue fever, was also brought to the fore, especially for people who live in tropical areas where mosquitoes that spread the dengue virus are common, but little or no awareness, inaccurate data account for cases that are mostly unconfirmed or undocumented. But here is what the dengue fever is and how it can be managed.
When we talk about prevention of dengue fever, we really have to look at it in the angle of things that are really feasible as at today and the level of science. One is transmitted by mosquito. So anything that we can do to prevent contact with the mosquitoes, that is a major thing that we should do, including manipulating our environment to avoid the presence or thriving of these mosquitoes, especially the Aegypti. Then secondly, it's of note that we do little when it comes to dengue in terms of treatment, because we don't have like any definitive treatment for dengue. So always we do in the health facility, we do palliative. I mean, we do some fluid therapy, and also encouraging patients, managing the fevers and what have you. Then we talk about the communities, roles of the community engagement, and creating awareness to the people that, look, you should not allow yourself to be bitten by these mosquitoes. And whenever you have somebody with sinus symptoms, you should rush him to the hospital for immediate assessment and probably diagnosis and management. And then we talk about in some countries, there are instances whereby the mosquitoes are being genetically modified and released to the forest, so that there will be decrease in the number of mosquitoes being produced that have access to the populace. And when it comes to vaccine, I knew so much that a lot of research is still ongoing in seeing to the development of dengue virus vaccine. The last time I know is still under development. I'm not aware that vaccine is now released for field trials or for the public use.
No,
so other things that we need to note is...
I mentioned earlier was for malaria, not for dengue fever. I was just asking for you to clarify for us if there is any of such for dengue fever.
As at now, I'm not aware that there is any approved vaccine for dengue fever. As academics, I'm a public health person. I also follow the state health system carefully and observe what is being done. I can remember that as at 2016, one of the things that was discussed is our ability of the health system to quickly catch the disease when it happens. And we even worked towards getting some diagnostic kits from Malaysia to be able to pick this disease whenever we have a suspected case. And as at today, the Ministry of Health, I have discussed this, and they are able to to bring out some public awareness system, and also make a statement that as at November, December, there is an outbreak of dengue, which as at now have subsided so much that we don't really have such cases being suspected as at November, December. So, and I believe because of the nature of the disease, by this time around, the mosquitoes are not as common as it used to be during Hamatan compared to during the late rainy season and during the rainy season. So this is what I can definitely say about the current situation in Sokoto.
We'll move on now to diseases that are transmitted among animals and then to humans due to interactions within the ecosystem. Bird flu was another outbreak that reared its ugly head for poultry farmers in Kebbi State, taking a toll on health and economy, although with efforts made to curtail the spread. But let's take a look at its effect, modes of transmission, management, and prevention strategies.
This is a very simple issue. We have to understand that bird flu, there are natural reservoirs that they are harboring these viruses in them, but they are not showing the clinical signs or ill signs. So once they mingle with other birds or other species of birds, they can easily come into spread the infection and then they come down. So what I'll tell you from the history we have is that this backyard, he has his peacock, and then we only connected the issue of local birds that were bought for ceremony, and they were kept somewhere around in the house. So we can easily say the local chickens may be responsible, but not, we may be wrong. But anyway, what happened is that this local chicken started dying, and then also the peacock also took off. So it was when he saw that the death is becoming rampant, and then he decided to run to the clinic, our veterinary clinic, for help. And that's when we come in and we asked some questions, and we took the remaining peacocks to the clinic to handle them. And then even with us, with our doctors, the peacocks continued dying. So this gave us a very high suspicion of what we are dealing with, and we took sample immediately to reference laboratory in Jos and Rivon for further investigation. And then it revealed that it was H5N1. Okay. So that's what happened. So the only thing is that we are dealing with a very small situation. A small situation in the sense that we have only 14 number of peacocks, only 50 local birds come make them. So, and at the time of all this saga, all the birds died. So, what remains with us is that we have to trace back. Let us see if we can get an information from where did they bring in the local chickens, the local market. And then two, we have to immediately disinfect all the area, all the contacts area. And we have to also bring all the people that are in contact with this house, with this bird, for inspection. So that's what we did immediately.
Right in here, doctor, if you don't mind. Now, you have stated that we have the local fowls and also some peacocks. I'd like to know, are there any other categories or species or types of birds that were also infected, perhaps undetected at the moment?
Yeah, I told you that he has only peacocks and then these local chickens that he brought for ceremony. He just bought them from market for someone and they kept them there very close to the peacocks. So, and then before he started the function, the local chickens started dying. So we are only dealing with these two species, the peacocks and these local birds.
Mpox, formerly known as monkeypox, was another disease outbreak in 2024, where the World Health Organization declared it a public health emergency of international concern, with Nigeria being one of the affected countries. Surveillance, monitoring, mode of transmission, disease response, and management strategies for the zoonotic disease was top priority for the Health Ministry in Nigeria. Take a look at the measures taken to prevent an exacerbation of this disease.
So Mpox was the same disease that was formerly known as monkeypox. And it is a viral disease that has been around for more than 50 years actually. And when I say viruses, so viruses and bacteria are infecting agents, for those who don't know. And there are many, many different types of viruses. So this is a particular type of virus, very closely related to the smallpox virus. As you might know, smallpox has been eradicated for many years now. So it's been around, and it was, and there are two different types of viruses that cause monkeypox. You have the clade 1 and the clade 2. So basically that just means that one of them is more likely to cause really serious disease, and that's the one they have in the Congo region. And the one we have here in West Africa and Nigeria is mostly the clade 2, which although causes serious disease, but is not as deadly as the clade 1.
But then how would you describe the current status of Mpox in Nigeria at the moment?
So you see, Mpox has been around for quite a while, but obviously, especially now that it has been declared a public health emergency of international concern, it's now in the news and everybody is talking about it. But I think you might recall about 2 years ago when we saw the first case with a boy in, whether it was just Bielsa or Port Harcourt. So it's been there, it's been increasing. There were a few cases before, but now obviously for many different reasons we're seeing many more cases popping up, and in many different parts of the country as well.
But for a layman, one would want to ask, how does it present itself? So
like very many other viral diseases, there are generalized symptoms. So basically that means that you have people complaining of headache and body aches. And of course, what everyone knows about this monkeypox virus is it causes rashes. They start off as small, as round, flat rashes, and now become those rashes filled with fluid. Obviously, there's also something called lymph node enlargement. We call it lymphadenopathy. So that is quite significant. If you've ever had a cold and you feel a lump either around your ears, in your throat, that's a lymph node. So with monkeypox, it causes lymph nodes all over the body to become enlarged, and that's how you kind of differentiate it from other similar diseases.
Okay, I'd like to know, you did say it's a viral disease and it's affecting a number of the population, but I'd like to know the transmission mode of this particular disease.
So monkeypox, or Mpox as it's now called. So interestingly, it's the same thing. It was just changed from monkeypox to Mpox, just to make it more suitable culturally and traditionally. So it's transmitted usually through about 3 different means. People can get it from animals. So we don't yet know what animals are the reservoir. When we say reservoir, so what animal particularly is responsible for spreading it. But we know it's been found in monkeys, it's been found in rodents. So people who go around maybe hunting animals, skinning them, maybe not cooking them properly and eating them, are at risk of that. Then, of course, it can also be transmitted from person to person. So if you come very close, physical contact or intimate contact with somebody who has monkeypox, there's also a chance of getting it. Of course, the third one is that if any clothing or bedding or other material is soiled with the fluid from the rashes and someone else gets in contact with it, that it can also be transmitted that way.
Finally, in the year in review, the effects of climate change was daring, from the heat waves and its health implications to flood-related incidents with resultant health issues on vulnerable population to the intense Harmattan season. Now let's hear from the experts on how to mitigate the challenges posed by the climate change as related to health matters and health outcomes.
Now, when you look at heat wave, one of the safeguards is that you keep yourself hydrated. This is an action that a citizen on his own can actually take. You don't need the government to give you water. You don't need the government to tell you when and how you should take water. But when you float, in a city like Lagos, one citizen or one community cannot be able to implement such safeguard. You need the resources and the technical and financial capacities of the government to be able to put the necessary safeguard that will mitigate or help the communities in Lagos to adapt to the problems of flash floods. So there are certain things, adjustment that can be made at citizens level. Citizens should be aware of their responsibilities to that. And there are certain safeguards that has to be put in by local government. Local governments must be aware of these responsibilities. There are certain responsibilities that are strictly for state and federal government. The government must be aware of these responsibilities and make provisions for them on time, because you don't have to wait until things are happening before you start mobilizing or activating your safeguard. No, safeguards are designed to be there before the emergency happens. That is the way we should be approaching them, and I believe that is the way forward.
As clearly pointed out, temperatures are high as 40, 41, 39 in different parts of Nigeria. Even in the FCT now, we have very high temperatures. So what happens is that when the environmental temperature is high, your body tries to regulate your internal temperature. Now, the internal temperature of the body has to be within a range for your body to function sufficiently, for the enzymatic processes, for the normal processes, we call them physiological processes. So for all the processes that make up a human being to function, these cells and your systems have to be at the normal temperature. Now, the normal temperature we accept in this environment is between 35.5 all the way up to 37.2. Now, that is physiological temperature.
Right.
When the temperature outside the body is high, what happens is that when the environmental temperature is high, what happens is that your body's mechanism for heat loss, which is through sweating and a couple of other mechanisms, is to a large extent suppressed. And that means that you can retain heat and the temperature goes up. Apart from that, you also absorb heat from the environment, and high temperature is not healthy.
Very well then, and that concludes this week's episode of the program Healthy Living on Trust TV. For comments, contributions and suggestions, follow and subscribe to all social media platforms. I am Aisha Salihu. Thank you so much for watching.